begin the next session. We've taken more than 10 minutes, but I hope it was a refreshing break. The next session is going to be chaired by Rosemary Mburu. She is online. So I'm hoping that she can, Rosemary, if you're there, you could come on video. You can enable your video.
Yeah, Ethel, you can see and hear me?
Great, I can hear you. I'm waiting to see you from my end, but I believe the other participants online, if you can post in the chat, can you see Rosemary? Great. Yes, so Rosemary is going to chair the next session. The next session will have 2 speakers. And then there'll be a little bit of a discussion after that. We're looking at it will have 3 speakers, sorry, 2 from East Africa country, partner countries, and 1 from the East African Health Research Commission. So Rosemary, I'm handing over the session straight away to you. Take it away.
Thank you very much, Ethel. Good morning, good afternoon, participants. Thank you so much. My name is Rosemary Mburu. I am the Executive Director for WAKI Health, which is an Africa regional advocacy organization. I'm based here in Nairobi, Kenya. We partner with IAVI on a number of coalitions or advocacy spaces for health R&D advocacy, including the Coalition to Accelerate and Support Prevention Research, that is CASPA, AFNI, which is the Africa Free of New HIV Infections Network, as well as the Coalition for Health R&D, which is CREED here in Kenya. I'm happy to chair this session. We are excited because we've had a really amazing and robust presentations and discussions in the morning, looking at the why of R&D, and then looking at generating evidence, tracking national expenditure, and also the impact of R&D investments and multi-stakeholder collaborations. And now shifting into the second session, we are connecting this conversation. And I think here the biggest question is where next? So we know why we need to invest in health R&D, the need for us to track expenditure, to collaborate, and also we've heard about a couple of lessons learned. So where next, in this conversation around tracking our progress to sustainable health R&D financing in Africa? So to do that, we have 3 speakers. The first 2 speakers are going to look at analysis of national budgets and 5-year trend in funding for health R&D. So these are 2 case studies from 2 EAC countries, East African Community countries. One case study from Kenya and the other case study from Rwanda. And then we will have a presentation which is going to be an assessment of domestic funding for health research in the East African region, which is going to be presented from the East African Health Research Commission. So without further ado, I will invite our first presentation from, it's a case study from Kenya by Dr. Joyce Wamishwe, the head of Division of Research and Innovation in the Ministry of Health, Kenya. So Dr. Joyce, over to you. And she is going to be controlling her slides. Over to you, Joyce.
Thank you, Rosemary. So let me just do that so that at least we can know the face. So thank you, Rosemary, and I'm hoping I'm clear. So I'll be sharing my presentation. Oops. Sorry about that. Okay.
And as you do that, Joyce, maybe to remind participants to kindly feel free to continue to share your questions in the chat. We already see some questions. We will be looking at that. If you're on social media, kindly look out for IAVI, amazing work there on Twitter, sharing and spreading this kind of messaging on the need for health R&D, the need for tracking health R&D expenditure, and the need for increasing this kind of funding. Thank you very much. Dr. Joyce.
Yeah, so thank you. And allow me to just take us through a couple of slides that will give like how we've been, from an implementation perspective, funding for health research and development in Kenya. So this is the outline of my presentation. By way of introduction, sorry, I don't know where to put this. Oh, wait. So by way of introduction, we have a national vision. We call it Vision Kenya 2030. And in it, one of our aspirations is to have a knowledge-based economy. And in the current Kenya health policy that we are working under, that's 2014 to 2030, indeed, we recognize that research is a critical component of any successful health system, and the need to prioritize the same for policy and intervention development. And this has really been emphasized by the previous speakers during the morning session. So from a policy and regulatory environment, we seem to have everything in place. We have the Science, Technology and Innovation Act 2013, that through it, several regulatory institutions have been formed, key of which is the NACOSTI, and that is really the regulator for all research in the country. Please note the word all research, and health is one of those. And then National Research Fund, and in this, it's very clearly written that R&D should be allocated 2% of GDP. And then we have the Kenya Innovation Agency. In 2017, we did have the enactment of the Health Act. And in it, we say that 30% of what the National Research Fund has should actually go to health research. Under policy, given that we know we need certain policy documents to guide health research, we do have Research for Health Policy 2020 to 2030 that provides concrete guidance on the development of national and county health research priorities, interventions, investments, and partnerships. And because we know that we do have many priorities, so we're always getting asked, so where should I put my money in? We do have the Ministry of Health that document Research for Health Priorities that guides the research priorities in the country, and this is reviewed every 3 years and updated accordingly. So in terms of now financing for health R&D in Kenya, from the forefront, health research is mainly still funded through donors. But from a domestic point of view, when we look at domestic financing, over the last several years, 5 years or so, including the last financial year of 2020-2021, the allocation to research is actually 5% of the health budget. However, when you now break it down, a lot of this goes to recurrent expenditure. So it primarily goes to our research institution, that is the Kenya Medical Research Institute. And then some good amount goes to the Kenya Medical training colleges. So we find that a lot of that money does go to paying of salaries of research staff and also in training. But what is actually used for research and development per se, what would actually lead to now the kind of conversation we're having today, is actually a small proportion when you look at it from that angle. we tried to see, I mean, no, we got a breakdown of in the last 2 financial years, but a bulk of the exchequer allocation was used for what we were asking. I mean, we wanted to see what it was used for. And mostly it was used for malaria studies. So under this, we do have a rapid diagnostic malaria test that was locally manufactured. And then we also have a malaria vaccine that's looking very hopeful. It's actually in the phase 3 studies. So that is what the monies were being used for. Then we had a bit of monies being used for HIV studies. And of course, given that COVID-19 came on board, a lot of money went to fund proposals and possible innovations under COVID-19. So in terms of now reflections, given what we know, as I said, from a policy and strategic point of view, we have what it takes. We have the documents that say you should have this allocated. But one of the questions we keep asking ourselves, so even as the Bamako Call said 2%, was there really a guide on what this should cover? Because we know research goes beyond training, goes beyond salaries for research staff, but really, for there to be actual research and development, we need to put in money into production, into, you know, the hard stuff, the hardcore stuff that goes into research. So is there a guide for countries so that they don't sit pretty when they think they have met the 2%, yet there is much more? Then under tracking of the allocations, in our country, unlike what I had in Rwanda, we have, I mean, on top of the NACOSTI, so there's the NACOSTI, and then we have now independent ethical review committees. We have about now 23 or 24, last I checked, and they are all giving ethical approvals, okay? And then we do have also the Ministry of Health that is, gives the final authorization, especially if you're going to go into health facilities or going to go to interviewing Kenyans, like conducting, I mean, door-to-door surveys. Now, the catch is NACOSTI falls under the Ministry of Education, and us here, we're in the Ministry of Health. We are now the ones, I mean, so we keep on asking, we keep on haggling between the two of us, who should be tracking these allocations. So we've had several meetings with the NACOSTI team where, and even the ERCs, where we requested that they should be having like a database. All those people who they are giving the approvals, we should be able to know who's funding that research. But recognize that a good chunk of this research is actually from universities. So people who are doing their postgraduate and PhDs, they also, I mean, they're the ones who usually will seek these study approvals. So, and when we look at what some of these studies entail, we keep on asking, okay, so there are people who are funding themselves. So how is that being incorporated into the 2% that we are talking about? So the who should track, and then how should this be done? Obviously, it should be done online, but the nitty-gritties of how this should be done is something else that we are now currently working with NACOSTI so that we can be able to have a semblance of all those things that, I mean, all the resources that have gone into any health research in the country. Then how about private sector contributions? You know, we never quite remember this when we are trying to figure out so how much has been put into health research in the country. But we know that private sector really contributes into health research. So how do we bring this on board? Then funding obviously follows success. Success stories need to be widely shared if we are to increase allocations from a domestic point of view. It is it's obviously advocacy is important, but I always ask, if we are to go to Parliament and ask that, can we get a bigger allocation for research? under our MOH budget. We'll be asked, so we gave you 5%. What have you done with that? We can't start saying, oh, that 5%, it actually was used for recurrent expenditure. I mean, people want to see what really this money has done. So the few success stories that we have, we should be able to share widely, because I believe that is where big firms like, for example, Safaricom will be interested in, say, if we're to have some research on digital health, So, but they cannot do that unless we show that we are doing something with the little that we are getting, or the apparent little that we are getting. The other thing is, of course, we know the time that we used to say a few years ago that one day donor funding will decrease. We are in that season, and there is need to intentionally increase domestic financing. And obviously we have to look beyond government per se. Domestic, I think, does not necessarily mean government, but I found sometimes when I'm having discussions with advocates for domestic financing for R&D, the push is really, no, government needs to put in this, but we forget that government works together with we do have a very strong private sector. So how about considering strengthening the public-private sector collaborations, for instance? How about pushing the community-based organizations to think at that level? How can they be able to contribute to R&D? So we need I think to really go beyond the domestic is equals to government. And government is, domestic is actually bigger than that. Then I've always asked myself, we know that as countries in Africa, we know that we do use certain data for planning. For example, the data that we get from demographic health surveys or from the HIV impact assessments. And these are surveys that come after every 5 years. Yet we are usually not able to plan very well, to the point where we find, like, if USAID is not there, then countries in Africa will not be able to do DHSs. So that for me is a question that I keep on wondering. Yet if a country knew that we are having the next DHS in, say, 5 years, they can be able to put aside some little money, and by the time that 5 years comes, that little money will be some substantial money, and then be able to say that, yes, on top of these modules in DHS, we also have 2 or 3 priorities we would want to add. But we are unable to do that kind of negotiation when we have not put much on the table. So this need for planning for key research projects, for me, is something that we need to also look at. Then lastly, research to market. We know, and we have seen in our regional conferences, from the Cambry, the CASH conference, to even the most recently held East African Health Scientific Conference, that we have brilliant people who are trying to come up with innovations. But there's this thing, and if you look across board, somebody works on something, goes and discovers that if you squeeze some extract from, perhaps maybe kidney beans, that it does heal, it does have an effect on, 1 or 2 maladies that we usually, have in our African, illnesses that affect our people. But it stops halfway, it stops midway, because when you try and follow up, why did this person conclusively reach where they could tell us that, yes, this can either be a medicine that is of use or a medicine that's not of use? Then you begin to ask yourself a lot of questions. We are left hanging. So we don't actually get to the market point, and we need to review what it needs to take to optimally achieve this in Africa, because we cannot just be doing research for the sake of it. We have to do research according to our priorities, And we have to make sure that at some point we get products that we were testing reach the market level, so that we can also be part of, we can also say that, yes, we have this diagnostic tool that's really working well, and people should, it joins one of those maybe WHO pre-qualified diagnostics that we can then be able to see being sold out there. So I feel this last bit is something else that we need to talk about, even as we talk about pushing for increase in domestic financing, because it is through this that we will get hugely encouraged to put even much more money into R&D. So in summary, health R&D is key to a productive, competitive country, and we know that. And obviously, commensurate investment should be made. But funding follows success, and therefore we have to be able to share these success stories and ensure that success, if it means research to market, that we actually get to market so that we are encouraged, to continuously invest in the same. And there is need for robust tracking system for health R&D. And this should actually go beyond allocations, because this is one of the things I feel also from an advocacy point of view, that we are interested in saying, okay, so Kenya has reached the Bamako Call, but we should be more interested in seeing that we have reached the Bamako Call, or we are about to reach the Bamako Call, but with whatever we have achieved X, Y, and Z for the benefit of our people. So with that, asanteni, and look forward to being part of the panel discussion. And thank you so much to the organizers for inviting us to this very key meeting. Thank you.
Thank you very much, Dr. Joyce. Thank you for your presentation. Great insights there. So many things to take home. I was wishing I was on Twitter. I could have been tweeting away, but I know colleagues and participants here are listening and taking in even the thought of provoking how you are challenging us, even as advocates. And so it's not just enough to have policies and guidelines. We have to ask ourselves, where should that go? What kind of allocations? What kind of prioritizations? You've talked about private sector, and we're going to hear more about that when we come to the panel. And the question but what is DRM? How do we define DRM? Is it just government money, or are we also talking now about tapping into private sector, talking into other areas within the public sphere? So thank you very much for that. I'm going to invite the next speaker. It is going to be a case study from Rwanda by Dr. Angeline Mumararungu, the Director of Planning and Health Financing Unit at the Ministry of Health in Rwanda. Dr. Angeline, you can hear me?
Yes, I can hear you.
Thank you very much. Over to you.
Thank you. Thank you so much, Joyce. Can I have the slides on? Maybe next. Sorry, go back. Good morning, everyone. Once again, as from my previous speaker from Kenya and the previous speakers, we have been all looking at how can we increase domestic funding for health research and development. For the country, for the case of Rwanda, I will be showing you how nationally funding has been injected in research and development for at least 5 years. Sorry, for 3 years. And go next. Next. And we shall also discuss about the challenges. And most of the previous discussants have talked about challenges. I will also iron out a few of them in addition to what has been discussed. Next. As part of the background, I just want to again bring back your attention to why we are talking about this financing research domestically. According to IAVI's declaration of July 2008, all countries committed to be allocating at least 2% of the national budget to the health and research development. And I think that's the cause of why we are here. We want that percentage to be reached and even more. For the case of the government of Rwanda, we have been making tremendous efforts to increase domestic funding in health sector across through various initiatives. And we have not also forgotten all about research. There is a consideration and also in the health priorities that research is key. I can't mention much more, like my previous discussants have really emphasized on this. Next. Okay, if you look at the trend, this is from the 3 years back, as I've said. Only the budget allocated for research you see there shows only national trends on MOH, the Ministry of Health, and affiliated institutions. That's the referral hospitals, RBC, the Rwanda FDA. And these are the only for 3 years that we captured from, if you look at the start of 2018, where we started to see how much is being put in. We look at a percentage of 0.06, which we are far away from the 2% from the declaration as countries committed to this. And when you look at the trend, it is increasing, which shows there is more that the government is injecting in from its domestic budget in research. And so far where we are, we look at 0.25 percentage from 0.09 in 2020. And if you realize, my colleagues have been talking about what COVID has brought in, and what has also the government put in as an effort to fund the COVID research and development activities. So you see the drastic increase from the national budget expenditure on research. And this has been also one of the contributors, and also other ongoing researches, the health research and development in other areas. Note that, as Dr. Eugene mentioned about the percentage of total contributions to research, we have not captured that, but he really mentioned that domestically, and the development partners, the private sector, whereby we heard about him talking about a 0.69%, which is a good one. But now here we are like only a portion of the national budget into that. And next to the challenge. So I will mention about a few challenges. Again, as I said, if you look at our trends, it doesn't include all funding for research in country, which means that we still have a way to have all the other sectors that get funding for research that are and development that are related to health being coordinated and recorded. Another challenge is insufficient budget still. We are still, that's why we're here. We are advocating for this, to have the countries increase more of the funding, as we advocate for different health priorities. So again, research has to be among to have more budget allocated to that, so as to be in line with the allegiance declaration for the countries' commitments. also, we realize that the challenge in the research, whereby the perspective of who is doing the research versus my colleague Darius mentioned about the policy and research. But again, when you come to the practical part of it, you find that policymakers and the implementers and also the external evaluators. So there has to be a clear way who does what, because you can't implement and you evaluate yourself. Also, this one is still being to be looked at. Some a few of the recommendations, and yet we will get more from the discussions here. In country, we are looking at institutionalizing data collection and reporting to record on expenditures on health across all concerned sectors, as I mentioned, to have the whole basket, the in-kind, the private, the other sectors, all that we know what goes in health research and development. Another, as the second one, we said it's insufficient, so we are going to advocate more allocations for domestic budget on research and development. Lastly, again, there's a recommendation. We are looking at separation of functions between the policymakers and researchers in the context of proper program evaluation and system improvement. As I said, there has to be, you have to do to implement, and then you have to have the evaluator. So, and then we have the meaningful and the impact of research and evidence in policy and decision making. With that, I would like to thank you. Those are the few slides. Thank you for your kind attention.
Thank you very much, Dr. Angeline, for that presentation, for bringing us a case study from Rwanda with concrete examples from the ground. And your presentation really just continues with the same sentiment and asks around stepping up domestic investments for health R&D. And one of the striking things in your recommendations is around institutionalizing data collection, reporting, which resonates with what other speakers talked about in terms of creating a robust tracking system for health R&D. And that really helps us as we look for how do we ensure that some of the challenges we experience where a lot of the input and resources in health R&D in Africa is not accounted for, it's not documented. So a lot of times it's very difficult to say what we are bringing to the table. And we look forward to further discussions on that in the panel. We actually had planned for a third case study, and I'm happy to say that we still are going to have that. It's a case study from Uganda. We have Professor Maxwell Otim. Just a minute. He is the Director, Science, Research and Innovation, Ministry of Science, Technology and Innovation in Uganda. We thank you very much, Professor Maxwell, for being here and for bringing to us this case study. Over to you.
Thank you, Rosemary. Hello, good afternoon, good morning, wherever you may be. Thank you so much for this opportunity. You've already introduced me. I am going to speak to an aspect that may not be directly responsive to the heading. Reason is that I just got the information yesterday night, and I just put together a few things, my slides that I'm going to share with you. Nevertheless, it is still addressing the critical issues that have been alluded to. I had sent a slide to Ethel. I don't know the slides to Ethel. I don't know whether they're available, but otherwise I think I'll just start. I think my colleagues have already articulately belabored to explain the basis of our health research funding in terms of the various sources. Particularly, I think there was this presentation from Kenya saying that largely health research is really in the hands of our development partners. The situation is not very different from Uganda. Thank you, Ethel. the situation is not very different from Uganda, but over the years, the last few years, I think some efforts have been made to kind of address domestic funding. And it's what I'm going just to walk through very, very quickly. If we can go to the next slide, where I talked about the different sources of funding. One of the critical areas that the government has been looking at is the overall funding of research and development. And of course, health research, I can tell you, is a top priority in this aspect. And with the creation of the Ministry of Science, Technology and Innovation, a national research and innovation program framework was put in place. And from 2019 until last year in June, the allocation was about $2.8 million per year. This was one aspect. The other aspect was the funding that goes directly to Makerere University, also on an annual basis. They have established what we call the Research and Innovation Fund, and it is capitalized up to about $8.1 million. And this funding, I must say, takes care of every aspect of research and development, including, and again, health takes quite a big chunk. The other part of the innovation fund that currently is in the public domain is with the Ministry of ICT, where they're mainly looking at a health innovation leveraging ICT. And it is also an annual fund, but I'm not sure of the amount that is available. I couldn't find the figures, and so I didn't put there any figures. The government has also taken note of the new dispensation, which has been ushered in by COVID-19 pandemic. And a model funding was put in place under what we call Presidential Scientific Initiative on Epidemics, where scientists in the health sector were mobilized to try and contribute to solutions of COVID-19, particularly focusing on diagnostics, therapeutics, and vaccines. Under this funding, is purely health addressing issues of the COVID-19 pandemic. Researchers acquired high-end specialized research and development equipment, some of which can be able to produce diagnostic reagents. They were provided with operational funds, and this fund was capitalized up to $11.5 million. So if you total up this, I think the trend looks very, very healthy. But of course, again, our hope and expectation is that it will be sustained. If we can move on to the next slide, where I want to talk about the emergence of COVID-19 as also, next slide, please. Okay, yeah, as also kind of reawaken our interest in leveraging indigenous herbal medications, because in a desperate situation for the last couple of years, many people have been trying many things. And some of the communities that have been using some herbal remedies actually demonstrated that these remedies are very effective, and therefore they have garnered a lot of interest. And the interest of government has been that this should be mainstreamed into conventional value chain pathway. And among other things is to really produce empirical evidence through research and innovation and following clinical trials. We have got a very classical case of a remedy called Curvidex, which was whose research was supported, among other things, by the Ministry of Science, Technology and Innovation. And now it has attracted resources directly from the government. Again, I do not have the specific figures to help the researchers to integrate it into the value chain development, conduct further research, and now that entity is actually autonomous in going now in the private sector. And again, the participation of private sector was already alluded to by the previous presenter. Next slide, please. So other sources of funding, of course, are partnership. One of them, we had a presentation on EDCTP. Uganda is a huge beneficiary of EDCP project. I'm also a beneficiary and supporting a lot of research in those key areas that we are referred to. Over the last 10 or so years, we have also been able to leverage resources from Swedish International Development Agency to support research in the university. As of 2018, the Swedish government had invested over $100 million to build institutions, and I can tell you that health research benefited enormously. We are still to disaggregate data when we do our STI status report. To undertake scientific research, human capital development in all the universities that were supporting undertaking research and development. Other sources of funding, many of our scientists have leveraged funding from NIH, and the two that come to mind is one that has been running on about the integrated biorepository for human health and hereditary. We call it H3 Africa. That has been going on again at the College of Health Sciences. There is a project, a grant that has been running and is still ongoing, I believe, on Health Professional Partnership Initiative grant. Go to the next. I'll now want to focus very, very quickly on the key framework, which is the National Research and Innovation Framework. The main goal of this framework is really so that we can have a fund that can promote research and development and also generate technologies that can be incubated and eventually roll into the market. And I think it has been fairly successful, notwithstanding its nascent stage. So the framework, which was adopted by Cabinet, actually provides a transparent and coordinated system where we do the planning, prioritization, and allocation and management of resources that come from government within the context of this National Research and Innovation Fund. Next, please. So the framework, the program actually supports knowledge development and technology for innovative solutions to societal problems. And I can tell you that, again, because of the priority that we have focusing on health research, health is a key beneficiary. And the presence of the framework really sets a clear basis for the nature of how resources that a government allocates for research and development can now be disbursed to innovators and scientists. Next, please. So the next slide basically talks about the governance of this framework. At that time, it's the minister responsible for science, technology, and innovation. And I must write here a caveat that after the last election in June, a new dispensation has come in where the Ministry of Science and Technology is being reorganized and also domiciled within the office of the president. The process is still on, but I believe that the new dispensation will still take care of this. And the rest basically tells you the processes that ends up with what we call funding assessors, which is really a dedicated and independent body that are very objective in their dealing to make sure that there's the transparency. Next. So basically the way this fund runs is that you will have, once you get the resources, you do the planning, agree on the priority sectors, and also specific areas that we might focus to, be possibly things like maybe cancer research or non-communicable diseases, and we make a call around that. We announce the call, and then the application we are received and evaluated, and those that have been deemed to be fit for purpose will then enter into negotiation with the program steering committee to make sure that the application is well aligned to the call, and then it is awarded, and then follow up, and eventually it is closed. It's basically what we call the funding cycle. Now, the windows that are available basically address research and development, and because we're very eager to make sure that research should be able to develop either technology or products or processes that should go into market. We look at also incubation and also support the commercialization of the products that come out of research and development. Next, please. So the role of the private sector has also been emphasized, and I also need to underscore it that if you please go to the next slide. Next slide, please. Yes, that all the funding windows under this program is structured to make sure that the private sector is involved. So that downstream of product development, it is basically the private sector that plays a bigger role. And therefore, we encourage academia, research institution linkages and in research. And also, we expect that once products are developed, the private sector would be able to support incubation and commercialization, and eventually rolling these products into the market. So identification of private incubation facilities is part of the process that is enshrined within this. Next, please. I'm just winding up on this, and then we'll move on to the next one in the next few minutes. So the priority areas, be it in health, we're looking at innovation infrastructure, supporting laboratories, research equipment, and also space. And then human capital development to make sure that there is a flow of human resource that will be available to take on the issues of research, and also strengthening the partnership between the academia and industry. And also overall, we are looking at research and development. Next, please. So again, I think there was a presentation from Kenya looking at the big picture of the National Development Framework. We're saying that innovation in small and medium enterprises should be given particular attention, because we want the solutions that can be used by by society, so that we see that research and development can begin to work for the people. Now, next, please. Just a few two case studies. There is also this emerging area of the 4IR and everything that is being done. We're saying, okay, how do we harness the power of 4IR to inform our development and also produce, get products and processes? So there is a particular case of emerging areas where we're looking at health innovation within the context of 4IR. I'm sharing you with this case because it is very instructive in that it brings together a consortium of institutions and agencies that whose domain is within the health research. And this particular one is the application of artificial intelligence and data systems addressing issues of COVID-19 and also any possible future pandemics. And this aims at looking at artificial intelligence, robotics, machine learning, and data analytics. As I conclude, Chair, next slide. Within, as far as governance is concerned, we have the Uganda National Health Research Organization, which is the apex body that facilitates research and development within the health sector. Other institutions include the National Council for Science and Technology, National Drug Authority, and President's Office that look at issues of ethics and also drug tests, clinical trials, and all that to make sure that whatever we do is for the benefit of the society, and also we minimize the effects of our intervention in terms of research. Chair, I want to plead with you that this is the end of my presentation. Given the fact that I was just given this morning, I would like to end it. And thank you so very much for your attention.
Thank you very much, Professor Tim, for your presentation, bringing us the case study from Uganda. And thank you so much for your availability to do that. Really, I think one of the areas you have introduced and laid emphasis on is, I think that we are seeing for the first time is the issue around governance, how, I guess, health R&D funding is governed, and that coordination, that cooperation becomes very important for the success of not just the mobilization and the allocation, but also in terms of the impact that the resources end up having. So without further ado, I will invite our fourth presentation. It is by Dr. Novat Tungubumwe. I hope I got that right or came close to that. He is the acting executive secretary for the East African Health Research Commission, with a presentation which is looking at an assessment of domestic funding for health research in the East African region. Over to you, Dr. Novat.
Thank you, Chairperson. I'm trying to share the screen. So is it okay? Do you see the presentation?
Yes, I can see it.
Okay, thank you so much. So I have to apologize. I have just joined the conference because I was having an interview on ESC positions. So I have not had opportunity to follow the other presentations, but what I can do is share just mine. Mine is just a kind of picture to share with you a kind of regional picture on how health research is financed in our region and what kind of sources we have. So it is about an assessment, a business assessment we have conducted in the East Africa Community partner states. The year of reference is 2014 and 2015, but I think the findings are still very relevant. We are observing the same situation, so meaning that what is there is still relevant and can be efficiently be used. Okay, so what we have to know is that a well thought out strategy to increase domestic financing really is critical to have a sustainable development for our region. And the East African Health Research Commission identified domestic financing as really one of the key challenges the countries are facing, especially in their efforts in health research. So again, in our strategic plan, we have this component of resource mobilization is a very strategic area. That is why I'm having I have problems, sorry.
And Dr. Novat, if you could share in full screen, that will help a lot.
Yes.
Yeah.
Sorry for that. So now we just carried out this business assessment just to get to have data on the financing requirements in partner states, the sources of financing, and also to propose strategies to increase domestic sources to finance research. This study, of course, was a four-pronged approach. We had a desk review, then we have a survey to collect quantitative data, and then we did interviews with the key informant, and then later we did a validation workshop where we got significant input. We globally, regarding the findings, you will see that the total amount of minimum health financing required in our region was that figure of $1,496 million US. This is the minimum which was required that year, but countries were only able to generate as financing as budget only around 200 million of US. So you see there is a gap of 195 million of US between what was required and what was generated, which represent almost 40%. Now, from the generated amount for the research, we have only domestic finance sources are just at the level of only 14.5%. So meaning that the very big part is from external sources, which represents 85%. So this is really the situation we have. Even actually it is still relevant. Maybe what is important to know also is comparing what is generated and the gross gross domestic product, GDP. So the total health research financing, when comparing to GDP in the EAC, it is standing at only 0.21%. And when we talk about domestic financing, it is representing, comparing it to GDP, only 0.028%, meaning that this is these lower levels of domestic financing have implications for the sustainability and the development of the research agenda. Comparing, this is graphs that show you, the first graph is showing health research financing as the percentage of GDP compared by countries. It is a summary of what I have said by using the graphs. And the second one is about the country minimum requirement for health research and development financing. You have the third one is the financing generated during that year of 2014-2015. Then we have the two remaining graphs on dependency on external sources, and also the gaps between what is required and what was generated. Maybe it is important also to go in deep with what is happening in each country. If we take the Republic of Burundi, the health research financing that year amounted to $1,789,000 of US$, but from which only 63,000 was generated from domestic sources. So you will observe that the domestic sources represent only 3.5%, which is really very low. On the graph here, we have the domestic financing representing 0.8%. The external financing is representing 22%, and we have a gap, a very big gap from what is required and what is generated of 77%. We have the same scenarios for the remaining countries where the gap is still very high, especially in the Republic of Rwanda. We have also the gap in an important gap also in I think in Tanzania and Uganda, it is better than in other countries. So this is the picture of what is happening in terms of sources, domestic and external sources. From there, we are proposing some strategies to increase domestic financing of health research. We propose that we establish laws that specify that at least 30% of research and development budget of the government be allocated to health research in the partner states. And this was from a validation workshop and from interviews. Second, we propose to earmark 10% of the sin taxes collected by each of the partner states about health research. Next, we propose we set up an East African Health Research Fund with an annual financing capacity of $20 million. And also we propose to mobilize 1% of the inward remittances of $3.4 billion from diaspora citizens for health research. and also to fundraise by embedding health research into corporate social responsibility initiatives of the private sector in its partner states. Also to direct, I guess other presenters, speakers have said, to direct that 5% of corporate social responsibility funding to health research. And finally, to increase health research financing through education and scholarships. These were some proposals we did just to try to increase sources of domestic financing. This is the graph that summarizes what I have said. And by adopting this recommendation, this will increase domestic financing of health by US $135 million for the next 5 years from the time we carried out the study. So it will be from, it will be from 8.6% to 35 of financing requirements. We have, of course, identified challenges in health research financing in the region. The first one is fragmented research efforts and prioritization. This is especially because of inadequate coordination of health research initiatives across the partner states. The next challenge we have identified is externally driven research agenda. This is clear when you look at the different sources, the domestic sources and external sources. We have the next challenge is about community linkages. So there is lack of involvement and the linkages with the communities in which the health research is conducted. This is an observation. And the next challenge is about how to give the greater role for academic institutions in health research. So we know that the potential of the academic institutions in our countries are not fully utilized in the health research. So this is also very important to think of providing greater role of these institutions. The next challenge we identified is the lack of infrastructure. This is widely known because health research and development infrastructures are inadequate in our partner states. We have also another challenge about accountability, because we normally accountability mechanisms should be put in place to ensure fair competition and the merit-based awards. This is also important to know so that we can put in place strategies to fill the gap. We have, of course, the human resources for research. This is also known. And we think there is a need to enhance human resource capacity for health research. The last but one challenge is about investment case. So, defining specific returns on investment in health research it is a complex issue. It's not easy to demonstrate it. So the investment case for health research is not well articulated. And this is very important to know that therefore the research does not attract attention of policymakers and the potential investors. And finally, we have this issue of intellectual property rights. That is also another challenge we have faced. So in conclusion, we observe until actually that financing health research is strongly still depending on external resources. So for sustainability, we have to think of innovative ways of getting more domestic resources. At our level, as East African Health Research Commission, we are in the process of developing a roadmap of how to increase local domestic sources of financing. And I think in the next opportunities of this kind of conference workshops, we have opportunity to share what we have done as a roadmap. I thank you very much.
Thank you very much, Dr. Novati, for that presentation. which really gives us a good overview of the status of health R&D financing in the region. Quite striking, in terms of the journey we have to walk and the gaps that we have to fill. I think what was striking for me and worrying and concerning is one of the data statistic that you gave us, that within the EAC region, we are investing about 0.21%, total of GDP of the region into health R&D, and really clearly there is need for us to step that up. You have shared with us various recommendations on how that can be done. So thank you very much for that perspective. At this point, allow me to bring the panelists. Most of them are actually joining us virtually. So I'll ask them kindly to be on video. So we have Dr. Joyce Wamishwe, did a presentation earlier. We have Dr. Novat, who just completed the presentation. We have Dr. Angeline Mumararungu, and we also have Professor Maxwell, who has joined us from Uganda. Kindly, if you can be on video so we have this conversation. Ethel, I want to do a quick check-in because we also have participants in the who are attending physically. I don't know how it's going there. Is it too quiet? Are we hearing any questions from there? How is it going, Ethel?
Actually, Rosemary, I'd like to give the participants in the room an opportunity to speak. You have your microphone on the desk. If you would just indicate if you have a question for the panelists, if you have an intervention to make based on the presentations, just indicate, raise your hand, you get the go ahead, you have a mic, we can speak, let's interact. So from the room, is there anyone who'd like to ask any question to any of the panelists? Okay, perhaps I'll toss it back to you, Rosemary. Oh, there is one. Yes, please introduce yourself as you ask your question and let us know whom you're directing the question to.
Thank you so much. Can you hear me?
Yes.
Can you hear me? Yeah, okay. Yes. Thank you so much. My name is Kasu. I'm a technical advisor at the Ministry of Health Department of Planning, M&D, and Health Financing. And thank you for presenters. My question is with regards to the university or the allocation of fund for education. And this has been presented in the Uganda case. I think the Uganda, they have one of the domestic fund allocation of fund for research and education to the University of Makerere. And this is, of course, recommended from the East African analysis, and this is correct. But as you know, most of the time, especially in developing countries, universities, because this their mission is learning, they focus on academia. And there is poor or inadequate linkage between university and the sector. And most of the time, the university research agendas are not really, most of the time, are not really the demand of the sector. So what can we learn from Uganda? Because it is one of the main source of funding for research. Can we have lesson from Uganda to show us the linkage between the university and the health sector in terms of, addressing the priority agendas of the sector? Because most of the time, even in scholarship, the prioritization of the agendas are based for academia. So can you just tell us the success stories? Because as it has been said from Kenya, funding will follow the success. So can we learn from Uganda? Thank you so much.
All right, maybe we can take about 3 questions, then we can turn to the panel. Ethel, maybe we can take 2 from the room and then 1 online.
Okay, do we have could we have another question from the room? From the participants in here? Yes.
Thanks for the opportunity. Prof. Wilfred Ndifon from EMS. I have mostly a comment, which is that when we're talking about health research, often there's a tendency to think about what is applied or applicable or close to application. We shouldn't forget the need to support work whose purpose is to foster understanding, right? So the need to solve a problem shouldn't be the main driving factor behind the research we support. Understanding, just the drive to understand, has often led to unexpected, unanticipated benefits in terms of applications in the health sector. I give you one example. So the developments in molecular biology, which started just from some people who had some successes understanding how matter works at very small length scales, right? Understanding the atom, developing quantum mechanics, asking questions about how do the building blocks of life function? You know, how do we go from these minute components to life? That led to molecular biology, and today we have DNA sequencing, right? Genomic sequencing, without which we won't have the vaccines against COVID, because those vaccines were developed on the basis of the sequences that were obtained. And so we need to have keep in mind the importance of this approach that is really foundational to what we do in the health sector. Thanks.
Thank you very much for your observation. I think I'll give it back to Rosemary. Rosemary, you may be having questions from the online participants that you'd like to progress with.
Yeah, thank you, Ethel, for that. The online team has been raising questions, and the conveners have been doing a fantastic job answering them, but also the presenters have answered quite a number of those questions live already. There is a question here to you, Dr. Novati, on EAHRC. What can we do to better coordinate our research efforts and leverage regional domestic resources for health R&D? So I will hand the floor over to the panelists. I know there is a specific question to Prof. Maxwell on Uganda, and there is also a comment around the drive to understand vis-a-vis the drive to only solve solutions. And then we can come back to a second round where we also look at some questions for you, Joyce and Dr. Angeline. Over to you, Prof. Maxwell.
Thank you, Rosemary. Yes, I appreciate the question that was posed in respect of what lessons can Uganda provide. But the discussion started by observing that most universities are primarily for imparting academic knowledge. But I think that is partly true. It is quite a paradigm that is most universities are actually moving away from. That many universities are craving to be research-based. And Makerere University is no exception, because there's been a lot of pressure on universities to show impact, how they're creating impact in the community and society at large. So many universities, as a matter of fact, are espousing the new paradigm of becoming research universities, and many are doing that. So I think we need to observe that. Now, coming back to the specific issues that I shared, this is a rather novel thinking based on this paradigm that I've just alluded to. One of the key areas that every proponent has to respond to is the role of private sector in what they're doing. That when you sit down to write your proposal and you have identified a problem in the society or in research, you need to leverage and explain the role of private sector in what you're doing. And it is one of the criteria that is used for evaluation and scored. So this is quite embedded in the process. And it's working fairly well. It's supposed, like I said, it's quite nascent, but we see a lot of these ideas that are clearly explained and the role of private sector articulated, and you see that ideas are coming out and rolled to the private sector. So it's working. And possibly with now once the output of this work is in the public domain, then it would be very, very easy to access. There was also a comment about basically what I summarize is the balancing basic and applied research. Now, I think it is true, basic research is very important and it has formed the basis of very good new knowledge. But now in our situation, in most cases, I think we feel overwhelmed by the challenges that we have in the society that research needs to work on very quickly. And therefore, you kind of like say, okay, can you come up with solutions to this challenge that you observe in the society, maybe malnutrition or some non-communicable ailment? And so it becomes an imperative that it is now incumbent upon us to set our priority. I think one of the panelists made a presentation and talked about research priority. In fact, the last from the East African Health Research Commission said one of our challenges is that we don't define our research priorities, both at that level and maybe even at the country level. And two, that because we do not put in enough resources to support these priorities, we might even be swayed based on the resources that we receive from our development partners. And since he who pays the piper calls the tune, that brings in the challenge. But I hear you very, very well. What the debate is, to what extent do we support basic research, given the overwhelming challenges, societal challenges that we face that research could address in terms of producing solutions, either in management processes or even products themselves. So I hear you, but I still think that this can be addressed based on our priority setting. Thank you very much, Rosemary.
Thank you for those responses and really critically looking at your experience in Uganda and sharing that with us. And really, I guess the point, to your point about priorities, are countries actually setting research priorities? Some countries are doing a really good job at that. Some actually perhaps are struggling with that, but definitely based on the presentations done earlier, completely agree on the need to set the priorities. I think the presentation from Kenya was very clear on that you talk about 2% allocation to health R&D, but doesn't necessarily point out to where is that going to be allocated and to what kind of things are going to be priorities. I want to turn to you, Dr. Novati, to your question, because one of the challenges you raised in your presentation was around the inadequate coordination, perhaps in the region, as far as health R&D is concerned. And there was a specific question to you on how can we do, or what do we need to do to better coordinate research efforts and leverage regional domestic resources? Your thoughts?
Yes, thank you, Rosemary. Yeah, this is a very relevant question because we, as an institution of East African community, we are using a regional approach. So actually, we have the situation of each country in the matters of financing research. So there is a step. There's a step of sensitizing its partner states. You know, we have countries who have ratified some declaration and signed some declaration, but implementation is becoming an issue. So we have first to sensitize partner states to implement what they have signed. And the countries are at different levels, of course, as you may have observed it. This is one approach, because it is only when we have a certain level of implementation of these tools they have signed that you can start a good coordination. The next step is to develop regional research programs. This is particularly important because it will address not this issue of identifying priorities. Some countries are well doing, others have not really done a priority roadmap. So by conducting regional research programs, it will address in part this issue of identifying priority research areas. So we have also, my colleague from Uganda has said that we do not have to ignore the role of the private sector. You know, in our region, the private sector is a very potential to help in moving in research and even in applications. So by promoting the partnership, what we call private-public partnership, by promoting this approach, we will also get an added value in well coordinating, doing an adequate coordination of research, but also on getting sources, local sources, domestic sources. So we are using a regional approach, but the first step is to know what is prevailing in each country. As we have a situation, we will use this regional approach, as I have said. I thank you.
Thank you very much for those reflections. I'll turn to Dr. Joyce and Angeline, because this whole conversation really is about increasing domestic resources and for health R&D. And you had fantastic presentations. One thing we are picking out here is that we are all saying that we need to increase domestic resources for health. Starting with Kenya. Kenya has done such a fantastic job. You know, the policies are there, the strategies are there. I think we've gone all the way down to even saying, 30% of the funding that comes to the National Research Fund, to the 30% of the funding will go to health funding. But from your presentation, we are at 5% right now. What do we really need to do to unlock the political will to actually step up investments in health R&D? What do we need to do? Who needs to take action, Dr. Joyce?
Okay, so thank you, Rosemary. And this is an interesting panel. So what do we need to do? So first of all, the 30% that I talked about was there's money that goes to the National Research Fund. So what we have done is exactly what Dr. Novat said they are planning to put in the roadmap for other countries to do, is ensure that we have negotiated for at least a third of that amount should go to health. Remember, National Research Fund is for everything research in the country. So being able to negotiate for a third is a good thing, So that is where the 30% is. The 5% is really out of the national budget, whatever comes to the Ministry of Health budget, 5% of that is allocated to research. The only thing I said is that a lot of that money is for recurrent expenditure. So we need to pay our researchers so that they don't flee to other countries. So we need to do that. And then we are training a lot of people. So the training colleges, so that there's also quite an amount of research that goes on. There was this whole story about universities, academia. We know a lot of research takes place there. But as well articulated by our previous panelists, what we see being done as research is not necessarily equal to what if you asked at the Ministry of Health, what is this is this type of research a priority for the Ministry of Health? So there is some disconnect between what universities are doing and what we expect to respond to our priorities. Now, going towards the political will, our president, for many times, has really talked about research, and particularly health research during this COVID time. We say we thank God for COVID from certain perspectives, and this is one of the perspectives. COVID came and it brought to us, it made us see as African countries that we can do a lot of things. I'm sure before COVID came, a lot of us never used to think that we can produce sanitizers. For example, we used to be like, okay, those are things that come from elsewhere. But we were able to do that. And even our premier research institution, KEMRI, has got, I was able to do a lot of work, produce a lot of sanitizers and many other things that we needed for COVID-19 control. And the president, during one of the many statements as he was giving out the COVID situation in the country, I think it was last year in May, really was deliberate about the importance of research in this country and pushed for monies to be pushed to Kenyatta National Hospital and to KEMRI for research. So when it comes, from a political goodwill, we do have the strongest political goodwill. But as I said, when we now sit down and look at the nitty-gritties at our levels, so for us, it is not that we don't know our priorities. We already know because we have even documented them. What we need to do is understand that, yes, as much as the president said, let KEMRI, let KNH get monies for research, it goes beyond that. We need to demonstrate what this money has done so that we can get more money. But we cannot just be pushing for more money when we have not demonstrated that we got X amount of dollars or shillings and what have we done with it? If we say we have been able to produce a local COVID-19 rapid diagnostic test, that's something you put on the table. And what has happened regarding that test? And there comes in the story of research to market. Now, we know, for example, that our premier institution was one of the institutions producing sanitizers. I go back to sanitizers. So it's called KEMRAB. But if you enter our supermarkets, you don't get to see KEMRAB as one of the sanitizers that are available to buy. Why? Why is that? Why is there a disconnect now between the research and this other bit of business? So we need to go beyond. So we have political goodwill, we know our priorities, but domestic financing goes beyond government. As I've said, we need the private sector. And then research to market is a conversation that we must have. And as I like to say, let us demonstrate whatever we have. This is what it has done for us to be able to negotiate and advocate for more funding. Over. Thank you.
Thank you for a comprehensive response touching on all areas: prioritization, political will, access to markets, et cetera. Thank you for sharing with us the status in Kenya, having the highest political support. But I hear one of the points that you really emphasizing on, let's not just track the expenditure, let us also track the achievements. What is the impact? Where is this money going? How can we demonstrate the value for health R&D investments? Because that success gets you resources and investments. We thank you very much. I'll turn to Dr. Angeline with the same kind of question. In terms of your take and your perspective on the same thing, is it a prioritization? Is it an issue of political will? Where are we in terms of ensuring that actually it is not just rhetoric, that we actually translate the policies, the strategies into actual investments in health R&D? Over to you.
Thank you so much, Rosemel. Actually, It's an interesting question. I will not differ much from what Joyce has mentioned. The country, Rwanda, as I had earlier on mentioned, there is goodwill to invest in research and development. But as I mentioned, we did realize we still also have what to do on the side of also institutionalization of recording, reporting on what has been already funded in terms of research in different sectors. So this gives us a basis. If before you advocate, you also first have to show what has been there, because actually you have to advocate for an increase from somewhere to somewhere. So as for our country, I look at as first doing the part of having all the contributions to research put together, and we know this is the percentage that we have, and then we advocate for more. And because already the political will is there, if there is already investors in investing in house, as we saw from from the previous speaker, I don't know, maybe Uganda or Kenya, private investors coming to invest in research and development. We do have those in country also, but still their contribution has to be more multiplied more and more. So what I can mention on here is that the country's will is already there. We have to see how do we coordinate this and then advocate for more. I'm not forgetting the aspect of capacity building. Much of the resources have been put in developing, they're like giving more capacity, training researchers, different universities and institutions. So all this is these are contributions, and these are the ones that we have to come to put together and to see what is the basket that is going into research. Otherwise, I think Rosemary, I would end by saying, the colleagues in the room, I would end by saying that Rwanda research is a priority, as Aria mentioned, and we are going to advocate for more budget, more increase in the ordinary funding, or on the domestic funding as the Minister of Health. Thank you.
Thank you, thank you, thank you very much for that reflection, but also the commitment from Rwanda in supporting health R&D. We are now moving to closing this panel, and I won't close without asking for just very brief, your final shot. Like, if we must get one thing right, what would that thing be to all my panels? And before I come here, Ethel, I'm in the process of handing over to you once we hear the final remarks. But, we've had a really interesting conversation from the presentations and from the reflections by the panelists in terms of innovative domestic financing. The presentation by Dr. Novat actually pointed to thinking about how we streamline, how the tax we collect can actually also be allocated, the innovative tax, like sin tax and all. And I think within that, you can unpack that further to say, how do we strengthen how we collect tax, how we allocate, and how we ensure that health R&D is part of that, We've had very strong remarks and recommendations around private sector. A lot of times, especially from our end as civil society and communities, we see private sector as a sector that thinks about profits before people. On the other end, we advocate for people before profits. And so there's usually some kind of tension there in terms of trust, like who do you trust? How do you pick the right private sector partner, etc. But all the panelists have emphasized on the need to think about the private sector, their role, how they engage. And I think there's food for thought there and further conversations that we can have in other opportunities. We do have an opportunity to have a similar meeting. There has also been a call, a very strong call to think about having robust tracking systems for health R&D. And the question that hasn't been answered, but the question that I think we have been given as food for thought is, who does the tracking? How do we organize the tracking? Like, because it is, this funding is governed by a number of bodies. Who actually does the tracking is the question. And I think that's food for thought as we organize ourselves at the country level to set up robust tracking mechanisms and really figuring out where will that be sitting, where will it be centered. But I think also within that, in terms of tracking, one thing that also came up is, what are we tracking? It's not just the expenditure. It's really good to track the expenditure. I'm also hearing it's really good that we get used to tracking the non-monetary input, especially from our end as Africans. When we do research, the non-monetary inputs that usually get forgotten and are not counted. And the last thing, I was hearing is, like, what are those opportunities we have in terms of ensuring that we have harmonized and regular reporting of progress and impact. We might not necessarily have answered all these questions, but those are some of the themes that are emerging in terms of the things we have to consider for us to make progress towards sustainability, more domestic resources for health R&D, and prioritization of health R&D in the political agenda, but also in the other agendas within that sector. So I'll just turn to my panelists for their final, very brief closing remark. 3 words of how you can sum this, or if we were to do just one thing and get it right, what would that one thing be? So I'll start with Prof. Maxwell, the same order, all the way up to Dr. Angeline. So Maxwell, your 1 minute or less than 1 minute final shot.
Thank you, Rosemary, and I appreciate my fellow panelists for the input that they have made. I'll go straight to the innovative aspect of the funding that we're looking for. I like the presentation by Dr. Novatis, but one thing I need to underscore is the private sector needs to be incentivized in many ways. Number one, let me just mention 2, through taxation policy and regime. Second, through procurement. They should be sure that if we get this in the market, it will be given a priority so that you don't need to compete with a similar product that is coming from China. And that will speak to the triple bottom line, which I think the last speaker talked about, which is the language that the private sector understands. How does the intervention impact their corporate triple bottom line? Lastly, accountability. Public sector. The people who allocate resources, we know them, they're politicians. They're looking for a period of 5 years worth to show, to flag. And therefore, it is important that we clearly demonstrate within the context that you've said of monitoring and accountability. You give us $1, this is what we have produced. If we keep meandering around and talking about scientific jargons of how processes, and I think it might not be very helpful. So we need to address this. Thank you very much, Rosemary.
Thank you very much for that. Over to you, Dr. Novati.
Okay, thank you, Rosemary. If I had one sentence to conclude with, when you compare the GDP and the percentage of domestic financing, it is really not very encouraging. So what I would really say is to urge partner states to give priority to health research and application, so that really we see that countries, governments are giving priority and know what is using evidence-based information. That will be my last sentence. Thank you.
Thank you. Thank you very much. Over to you, Dr. Joyce.
Okay, so thank you, Rosemary, and my appreciation to the panelists and also to the participants. My one sentence is, I have several, but I'll just pick one from my perspective where I'm seated currently. The Ministry of Health is we must track our allocations into health R&D, but tracking must go beyond the allocations so that we can be able to demonstrate tangible achievements to build an investment case for increased domestic financing from the various players. Thank you.
Thank you, Asante. Dr. Angeline, you close for us. Final remark or comment?
Five things, but I will mention only one. COVID pandemic has shown us that research and development is very key. We have been talking about increasing more funds for research, but again, we talk about, let's look at the researcher side. What are those researches that are being transitioned into decision-making and policy? This has to come out clearly. My colleague from Uganda, I think, has mentioned this. What is the, no, I think Joyce from Kenya. What is that evidence? What is that the outcome that convinces the one that gives money, the government? So actually, I want to put it out there to every researcher in the room. Let's transition, translate what we are doing. That's maybe a part of research and also the development. Actually, the same, they go together. Let us put it out there to convince the decision makers to allocate more budget for research and development. I will end here. Thank you so much.
Many thanks, Dr. Angeline. And actually, you bring us to where we started, you know, with the first presentation that was looking at why health R&D, which is what we are talking about. We need to make a better argument. And we were given four reasons in the first presentation in the morning, like why health R&D matters. We talked about it helps in saving lives. We talked about economic growth. We talked about health security. And there was one more. Somebody should remind us. There was one more. There were four things. Saving lives, economic growth, health security, and one more. That's your homework. Thank you very much, dear panelists, for such an excellent panel discussion. Your input and insights have been very, very much appreciated. I thank you very much. Handing back to you, Ethel.
Thank you so much, Rosemary. And thank you for summing up the meeting so well. My one takeaway, I think, has been the need for us to not only track what goes into research, but track also the impact and make the business case for investing in health R&D. At this point, I'd like to invite Dr. Pafe Walirae to come and close for us and give the vote of thanks, after which I will explain where next, what we do next. Dr. Pafe.
Thank you very much. Thank you very much, moderator, Ethel. Thank you very much, all participants here. I think it has been a very good discussion today. I think this is the first time that we are getting together as both national, but also international, but even the East African community colleagues on this dialogue around how can we increase the domestic financing for health research and development. I will be brief as closing remarks. First of all, I would like to thank each and everyone for the active participation, both those who participated here physically, but also those who participate virtually. As we are all aiming at advocating for more domestic funding for health research and development, we all agree that we need as we advocate, you know that if we all know that if you're advocating, that means we need to build a case, a strong case. That's what one of the elements here, as economists mentioned, it's what's called business case. To build now our business case, that means we have to build, in simple terms, a strong case, but also we have to prepare the ground. We are not the one who gives money. I mean, we are from the health side, but if you're going to approach the Ministry of Finance, that means you have to have to prepare the ground. By preparing the ground, I would like to just mention a few things that we can go with as a homework, all of us, either you are coming from the government or public sector or private, international, external organization or international NGOs. I would like to mention just a few things. Number one, we need to make sure that we are all well coordinated. Coordination, I just wanted to emphasize on 2 points. Ownership of the program or the health research and development. We have to push forward that agenda. Number two, we need to collaborate better and better for the sake of bringing new solution to serve to the need of our people. The second point I want to mention, we need to have clear framework on how to conduct researches, but research responding to a specific question we have in our health sector. This means it's required that we need a good framework or clear framework to generate evidence, but that evidence should be used to or translated to inform the policy and practice. Either you're coming from the side of policymakers, it helps you to shape again policy and strategic intervention, or you are practicing, a practitioner, you have to adapt your practice according to the evidence that has been generated through the research. The third point, or the last point, will be how can we build the capacity of our researcher? We have seen that one of the issues that we have, it's most of the time the research are somehow externally driven. Externally driven with agenda, but those who have the money, I can say those who have power. But if you have built capacity of our people, that means capacity goes with how to negotiate, how to conduct research, how to compete with other research, either at the national level, region, but also at the global level, as we have seen that it's one of our priority. So those were just the few points I wanted to emphasize for the closing remarks. Otherwise, I thank you so much. That's not I officially, on behalf of the Honorable Minister, officially close this advocacy meeting. Thanks so much.
Thank you so much, Dr. Parfait. With that, yes, with that, my colleague, Marie, and her team are going to direct us on where to go next. We are going to have lunch together, and the people online, I hope you also have a good lunch lined up. I would be remiss if I did not thank USAID and AVAC for having made this conversation possible, for having funded us to be able to meet together here. The recording of the webinar will soon be available online. We will let you know via email when it's available. And the conversations and action must go on. So look out for lots coming, and let's be ready to engage, and let's be ready to act. With that, I'm standing between us and lunch. So I release us to Marie Michelle and team to guide us to where we're going to have lunch. Thank you.